Welcome to another EduMed video in the series on ITU ward rounds, and today we'll be focusing on jobs, the J in the ABCD approach. We'll be talking a little bit about how to think about job setting, and then common jobs that most patients require. So, a really useful way to divide up the jobs that you should be thinking about for every single patient is what transfers the patient requires, any external reviews that the patient may require, any outstanding investigation results that need to be chased up, and any procedures that need to be done for the patient. When thinking about the transfers, it's worth thinking about the timing of these and who will do the transfer. If the patient's intubated and ventilated, they're going to require a nurse and they're going to require an airway trained doctor to take them to wherever they need to go. And so you're going to lose a doctor and also lose a nurse. So you need to make sure that the unit is adequately staffed to be able to do this. And obviously, you need to find a time which is mutually conducive to both you as the airway trained doctor and also the imaging department, if that's where they're going, to have a slot free for the patient. When thinking about external reviews of the patient, it's worth thinking about the exact question that you want the team to answer. There's no point in asking a team to give you a review if they don't answer the specific question that you need. Always get help from the senior doctors on the unit, be that the registrar or the intensive care consultant, to give you a clear-cut question that you need to ask the visiting team so that you can move the patient's treatment forward. Often it's really helpful to keep a list of outstanding investigations for each individual patient. The reason is that we often do multiple investigations for patients and then forget all about it. The perfect example of this is cultures that are taken for patients and then we forget to look them up later, and then we find that that patient had a positive blood culture 2 weeks ago which we haven't treated appropriately. So always try and keep an outstanding investigation list for each individual patient and update it on a day-to-day basis. And the final thing is, what procedures do the patients need? Things like line changes or an extubation. And making sure again that you time this appropriately with the other things. If the patient needs to be extubated but they also need to have a CT scan, well, after extubation you're not going to let the patient go off the unit for at least 4 or 5 hours at the very least. And so if you do want to get a CT scan, is it worth getting it the next day? Or if the patient is likely to be very agitated, should you get the CT scan whilst they're intubated? And then you've got all the information you need before you then extubate them. So it's worth thinking about all of these things when creating your plan for the patient. Common jobs that most patients require. Always ask yourself whether the patient needs a line change. If the patient has complex microbiology, do ask for microbiology reviews. Most units have regular weekly or even more often microbiology ward rounds to make sure that any new cultures are flagged up. But it's always worth for you to check this for yourself as well. It's always worth asking yourself, how are you weaning the patient's ventilation, and coming up with a plan in conjunction with the physiotherapists and nurses. A vital part of intensive care is communication, and updating both the patient and the family is really important, both in terms of the patient's mental health, feeling like they're improving, that they're getting better and that there's a plan in place, and also for the family, who can often feel quite far removed and worried about the status of their family member or their loved one. So updating them is really important. And then the final thing is actually making sure you have MDT input from each person within the MDT. And this can be the physios for chest and for just generalized muscle weakness, dietitians for looking at the feed, whether they're absorbing, whether it's adequate caloric intake for the patient, and also the base team, who are often forgotten. But it's really important to give them updates, because you may well find that they have things planned for the patient that you weren't aware of. So by constantly giving them updates every day or every couple of days is useful if they haven't had the chance to come and see the patient, or if they've come and seen the patient but haven't quite got a handle of exactly what's going on, which is often the case. So in general, the way to think about the jobs that you're going to generate from your ward round, think about transfers, think about reviews, Think about procedures that you're going to do on the patient, and think about the outstanding results and chasing them. Don't miss those common jobs that I said. It's very often the case that people forget to do certain things like touching base with the base specialty, or talking to the family or to the patient. These are really important, and actually the most important part of intensive care is dotting the I's and crossing the T's, and these are certainly things not to be overlooked.